How to tell if your dog has parvo. Canine parvovirus infection, also called parvo, is a highly contagious gastrointestinal disease with a high mortality rate. The virus is common in puppies. Experienced dog owners and breeders often panic when they suspect one of their dogs has parvo. They know how quickly the condition advances and how lethal it can be. If your dog has parvo, getting to a veterinarian quickly can increase the odds of survival, but the symptoms of parvo can be confused with the symptoms of other canine diseases, including coronavirus infection, bacterial hemorrhagic enteritis, coccidiosis, and hookworm infestation. Recognizing the symptoms of parvo. Consider your dog's age. Parvo typically occurs in puppies between 6 and 20 weeks of age, and 85% of all infections occur in dogs under 1 year old. Puppies are most susceptible because they have a very high number of rapidly dividing cells in their stomachs and intestines. These cells are the primary target of the parvovirus. If your dog is older, parvo is unlikely, though certainly not impossible. If your puppy's mother was not vaccinated against parvo, it's possible for the virus to appear even earlier, in the first few weeks of life. Factor in your dog's breed. Parvo is more likely in certain breeds, including Rottweilers, American Pit Bull Terriers, Doberman Pinschers, and German Shepherds. If your dog belongs to one of these groups, be particularly vigilant in watching for parvo. Monitor your dog's behavior. In general, the first sign of a parvo infection is lethargy. Your puppy may become less active, eventually retreating to a corner and staying put. This lethargy is typically followed by weakness and loss of appetite. The signs are rapidly progressive, with a quiet dog quickly becoming critically ill with foul, bloody diarrhea. Watch for fever. Dogs with parvo usually develop a fever between 104 and 106 degrees Fahrenheit 40 to 41 C. Pay attention to vomiting. Parvo destroys the stomach, which is full of the rapidly dividing cells that the virus targets. The stomach lining becomes irritated and ulcerated, causing your dog to vomit. Pay attention to your dog's stools. Typically, the diarrhea associated with parvo is particularly severe. It is as if the dog is passing blood, a very liquid and foul-smelling diarrhea. This may lead to dehydration as well. Check for signs of anemia. Parvo causes gastrointestinal bleeding, which can lead to anemia. To see if your dog might be anemic, press down on the gums. A healthy dog's gums will quickly return to their normal color, usually within 2 seconds. If it takes longer, your dog may be anemic. Anemia may also lead to a noticeable paleness of the gums.